Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. So tonight we are going to be talking about IBS and we'll be discussing some of the symptoms of IBS. I have a lot of people come see me wondering if they have IBS and they may be having symptoms that could be consistent with that. And my job today is to discuss what those symptoms could be, but more importantly, what those symptoms aren't. And so I want to go through exactly what IBS symptoms are and what IBS symptoms are not. So when we think about IBS, at least within the GI medical world, you have to have abdominal pain associated with IBS. And so without abdominal pain, you do not have IBS. Now you may have diarrhea, you may have constipation without pain, but pain is a primary component of IBS, and that pain has to get better with bowel movement. So you have some cramping or abdominal pain that seems to get better with the bowel movement. That classifies IBS. Now you can either have diarrhea or constipation predominant depending on the majority of the symptoms, or you can have even a mixture between the two, fluctuating between diarrhea or constipation, maybe fluctuating within the hour, within the day, within the week, or even within the month. But I also have plenty of patients who have only diarrhea as their main component, or just have constipation as their main component as well. And you have to have these symptoms for a couple of months. You can't have these symptoms recently. They have to last for a few months and be consistent and also have that abdominal pain that I talked about before. Now, the typical GI symptoms of IBS not only includes abdominal pain and diarrhea and constipation, but you can also have other symptoms that can make IBS a lot worse, including bloating, upset stomach, nausea and or vomiting, a change in bowel habits, or even belching or flatulence. These are very common GI symptoms associated with IBS. But there are also plenty of non-GI symptoms associated with IBS, and this includes things like painful intercourse, problems with urination or frequency or urgency. Fibromyalgia is a very common comorbid symptom with IBS, so a lot of people have fibromyalgia, also have IBS as well, and vice versa. You can also have poor sexual function or just feel tired and fatigued. These are all very normal components of somebody who has IBS. The difficulty about IBS is that you can have more than one symptom. You may not have any symptom at a particular time and feel great, or you may have a different combination of the symptoms depending on your day, your emotional state, what you've eaten, a lot of other different factors. And so this can make IBS very difficult to not only treat, but to deal with, because you can have symptoms that fluctuate on a very rapid basis. You don't know exactly when your IBS symptoms may hit, nor do you know how bad you may be having these particular symptoms. And you can also have additional combination of different symptoms depending on exactly what's going on. So these are the typical symptoms of IBS. And when you have IBS, this is what we look for to help us diagnose somebody with IBS. Now, there are a couple things that IBS should not do. This is very important because if you have these other particular symptoms, you should make sure you see a healthcare provider to see if something else could be going on within your GI tract. So IBS should not wake you up from sleep. You should not have very significant pain or diarrhea that wakes you up from the middle of the sleep. You should not have a significant amount of nausea and vomiting as well. You may have some, but nausea and vomiting should not be a primary symptom that you're having. It shouldn't be the main reason why you're having a lot of the issues that you're having. You should not have significant weight loss. That's not typical of somebody who has IBS. You should not have other symptoms including night sweats. Night sweats are not a typical component of IBS. If you have this, make sure you speak to your healthcare provider about something else that could be going on. You should not have pain associated with anorexia, malnutrition, or weight loss. This is something that's very important to realize because this is not typical for IBS. And if you have this, make sure you speak to somebody about this. And lastly, I know diarrhea is a very common component, but there's a certain type of diarrhea that should not be associated with IBS. So it should not be a large volume, should not be bloody, it should not have bowel movements in the middle of the night, nor should you have greasy stools. These are diarrhea symptoms that are not typical of IBS. And if you notice your diarrhea have any of these particular features to that, make sure you speak to your healthcare provider about whether something else is going on. And we may do further investigation to make sure you don't have any other condition. And so we have these warning signs within the GI world that perks our ears up, that if we hear this, this makes us think that something else could be going on beyond IBS. And like I mentioned before, they include these symptoms, which I mentioned in the previous slide. They also include things like having symptoms of the IBS, typical IBS after the age of 50 years old, severe or progressively worsening symptoms, unexplained weight loss or anemia, your blood is low, if you have nighttime symptoms or you have to get up in the middle of the night to have a bowel movement, if you have fevers, chills, or travel to an endemic region, if there's a family history of colon cancer, celiac disease, or inflammatory bowel disease like Crohn's disease or ulcerative colitis, or you have rectal bleeding, these are warning signs that we look for whenever we talk to our patients. And when somebody has these particular signs, we want to make sure nothing else is going on there. We want to make sure that we can figure out exactly what we can do to get these symptoms taken care of. Now, if you have these warning signs, I would encourage you to make sure you don't just blow them off as IBS symptoms. Make sure you speak to your healthcare provider because something else could be going on within your GI tract. So in summary, we use symptoms as a base to help us diagnose our patients. And then one of the more important things to realize are the warning signs and when IBS is not. There are a lot of things that IBS could be. There are more important things which IBS should not be or could not be. We want to make sure that we don't do anything to blow off patients who may be having these warning signs.